All right, welcome everybody, and thank you all so much for being here. We really appreciate everyone making time today for what is going to be an amazing debate. My name is Brian Rubai. I'm the debate coach here at the University of Iowa, and tonight I'm honored to get to introduce you to four great students who are going to tackle one of the most important and timely topics in modern politics, COVID-19 and the global vaccination campaign. The students today will debate the resolution resolved that the Biden administration's COVID vaccine distribution strategy is globally irresponsible. As the US and many other wealthy Western nations begin to offer their populations a third booster dose of the vaccine, much of the world is still awaiting their first dose of the COVID vaccine. And on the affirmative today, the debate team from Rwanda will argue that it is irresponsible for the United States to pursue its booster campaign before a larger portion of the world's population is vaccinated. On the negative side, the team from Iowa will argue that the United States faces a potential COVID winter surge and needs to pursue both domestic vaccine booster strategies and an aggressive international campaign. Now, before I turn things over, before we get this debate started, I want to just offer some quick thank yous. The first is to our participants here today from Team Rwanda. Anak and Assunta, thank you so much for being here tonight. We know that it's very late where you are, and we appreciate all the hard work that went into making this happen. A big thank you to Program Director Jean-Michel and Program Coordinator Adelph, who have done fantastic work. When you all visited campus in 2018, it was one of the highlights of my time here at Iowa, and we cannot wait to welcome you all back here soon. I'd also like to thank the students here from Iowa today, Subi and Ellie. They are the two squad captains and the two elders of the University of Iowa debate team. They are also just incredible leaders. They came here today after competing at Harvard University this weekend and in between classes. And I just want to say thank you for all of your hard work and thank you for making today's great event possible. Thank you so much to the alumni of the A. Craig Baird Debate Forum on this call. Your support is what makes hosting events like this possible, along with the Office of the Provost, University College, the College of Liberal Arts and Sciences, and the Department of Communication Studies. Thank you so much. Your continued support is what enables debate to stretch the boundaries of campus and thought. I'd also just like to say one last big thank you to Director and Coordinator of Forensics, Paul Bellis, who has been working tirelessly the last 2 months to get not just this event up and rolling, but all the events coming up with our reunion. Paul has been a fixture in the Iowa Debate Office and has been doing everything. Thank you so much for all your hard work. And thank you so much again to our audience for joining us. With no further ado, I'm going to kick it over to the iDebate Rwanda coordinator, Adelph, who has done a fantastic job of helping to coordinate this event. And she will help introduce the affirmative team in tonight's debate.
Thank you so much, Brian. Hi, everyone. My name is Adelph Rugundana. I work with iDebate Rwanda. And this is our first event with the University of Iowa. And for those who haven't had the chance to attend our previous events, please visit our iDebate Rwanda's YouTube channel where you can get to view them. And our iDebate in general, iDebate Rwanda is an NGO that uses debates as a tool to promote public speaking and critical thinking skills. We're a firm that believes that public discourse can solve so many of ongoing conflicts. So we run regional and international programs, but I will not get too much into details for the sake of time. So please visit our site that is provided in the description box. And yeah, have a nice debate to my debaters and Iowa debaters. And now I'll give the floor or the screen to Enoch, the first speaker on the affirmative side. Thank you so much.
Okay, thank you. So good evening, everyone, and thank you for joining us today. A special thanks to the University of Iowa for taking time out of their busy university schedule and joining us today. The resolution today states that the Biden administration's COVID vaccine distribution strategy is globally irresponsible, with the affirmative case being the decision to prioritize a third booster shot for American citizens instead of increasing global vaccine distribution is irresponsible vaccine nationalism. We live in a world of limited resources, and as a global community, we need to prioritize the small resources that we have in order to have optimum results. COVID-19 vaccines are in short supply, and as the affirmative team, we believe that providing the first and second dose to the world's poorest countries instead of giving a booster shot will have the greatest impact. According to the WHO, the distribution of these vaccines has been hampered by manufacturing delays and supply distributions, leading to shortages in countries such as Uganda, Zimbabwe, Bangladesh, Trinidad, and many more. The focus on booster shots places the possibility of a slight boost in US immunization rates above the lives of global citizens still seeking their first dose. So my first argument will be that the Biden administration policy undermines the global efforts led by COVAX to first vaccinate at least 20% of each country's population. The question stands, why would the US strive to invest resources into creating a booster shot rather than conforming to the WHO requirement of ensuring that all countries first vaccinate at least 20% of their population? According to the World Bank, 1.1% of people living in low-income nations have received at least one dose. It is no surprise that countries suffering from different conflicts and poverty, such as Mauritania and Mali, have vaccinated less than 2% of their population. And according to WHO, on a report given on the 28th of October, Africa has fully vaccinated 77 million people, which is only 6% of their population, while in comparison, 70% of high-income countries have already vaccinated more than 40% of their people. The underlying issue has less to do with the unconditional global provisions and more about the blatant denial of unconditional support. Ignoring the needs of these African nations demonstrates that vaccine sales and profits are resulting in mushrooming of investors at the expense of low-income African nations and other low-income countries, since they have nothing to offer in return. Our second argument would be that the vaccine nationalism that is being spearheaded by the Biden administration will have a devastating effect on low-income and poor countries. And like all these high-income and developed countries, a lot of these African nations and all these other low-income countries have poor infrastructure and they can't treat their citizens. In some countries in Africa, falling sick is basically a death sentence. According to the head of the African Centers for Disease Control and Prevention, John Nsonkong, Africa's positivity rate was at 11.2% as of July. While events like the looting in South Africa might be account for the high cases, we cannot ignore the fact that low-income countries do not have systems in place to facilitate the distribution of vaccines to these economies. Lastly, the affirmative side will argue that Biden's policy is leading to a waste of vaccines due to the anti-vax movement that is on the rise and making other communities that are in dire need of vaccines left to die. There are a large number of COVID-19 vaccines that are being wasted every day due to the growing anti-vax movement. According to an estimate from the Kaiser Family Foundation, 98% of 100,000 patients, American patients in hospitals, refused to take the vaccine even though it was available to them. This is an alarming number because out of all these 100,000 people, 98% of people didn't want to take this vaccine. This shows that even the people who are people who could literally be on their deathbed are still refusing to take the vaccines. So when you think about it, what hope is there for Americans that are yet to feel the adverse effects of the COVID-19 pandemic? Tens of millions of doses already in the US are not being used right now, while the government uses more state funds to supply a booster. In addition, these vaccines are being wasted while the government uses, in addition, these vaccines are being wasted while there are billions around the world who are willing but unable to get these vaccines. With a good and clear conscience, how could you possibly waste any more time and resources making a booster shot for people and for a population that clearly doesn't want the first 2 doses anyways? So in conclusion, I'd like to urge the jury and the audience to understand that that the issue here isn't whether the US is able to donate or be able to help these other countries. The issue is that the United States and the Biden administration should not be prioritizing a booster shot over the lives of global citizens. Thank you.
Thank you so much, Enoch. So we have the cross-ex for 2 minutes.
Okay. So in your second point, you talked about how many African nations lack the facilities to distribute the COVID vaccines in the first place. Isn't this another way of hampering access to the vaccines in the first place?
Well, since the pandemic started and since the vaccine increased, obviously over time the distribution methods have been improving and improving. But then these methods themselves can't improve if the African nations that you're talking about themselves don't have the vaccine to actually work with and to actually try to distribute. So that is an important factor because without the vaccine itself, how can obviously I accept that although distributions may not be at the optimum level that they should be at, also the important thing is first to provide the vaccines before we move on to the distribution strategy, because how can you distribute something you don't have? Yeah.
That absolutely makes a lot of sense, Enoch. And I was like, one of the things you said is how there's a vaccine in America, but people are unwilling to take the vaccine, leading to a lot of waste. How would African nations attempt to solve the waste by not being able to distribute the vaccines, right? So if they can't effectively distribute the vaccines, how will they counter the waste that would happen if those vaccines can't be distributed in the first place?
Well, I feel like your questions are not focusing on what the motion is basically about, because you're talking about people not wanting and wasting vaccines when there are no vaccines. And as I've said before, if only 6% of the African population are vaccinated and there are many people in line to get the vaccine, then I'm sure it's not the debate should not even be about whether Africans want to take the vaccine, because clearly we have seen that a lot of vaccines have been donated and many of them have been being used. So I think that's something important to note. Yes.
That's wonderful. Thank you.
Thank you.
So now we'll have the first speaker from the negative side.
Awesome. Thanks everyone so much for joining us today. We'd like to especially thank our wonderful competitors from Rwanda for staying up very late to make this event possible. The affirmative is correct about some important parts of today's debate. We agree that the US does have a strong responsibility to aid global vaccination deliveries. However, we will argue that boosters are a way to fulfill the United States' responsibility to address COVID globally. We will make three primary arguments. The first is that boosters are necessary to contain the spread of COVID in the United States. This is especially important as the United States faces a potential winter COVID-19 surge. Second, global success starts at home. The United States' responsibility to curb the global spread of COVID requires first and foremost that the United States contain the spread of COVID in America. That obligation is not mutually exclusive with providing booster doses in the United States. Finally, even if the strategy of the Biden administration is not perfect, it is far from being irresponsible. The United States has pledged 1.1 billion total COVID-19 vaccination donations, and has already shipped over 160 million doses to at least 93 different countries. Our first argument is that the widespread delivery of booster doses is the only way to prevent an otherwise inevitable winter COVID surge. Those Americans who received their first vaccine dose, the most vulnerable members of the United States population, are already beginning to see diminishing protections less than 6 months after their second dose. Rebecca Weintraub, the faculty director of global health delivery projects at Harvard University, noted in an October 12th piece that, quote, the US vaccination campaign is at a pivotal point, and that the US must, quote, boost COVID vaccinations to prevent a winter surge. The risk of a surge in infections due to waning immunity, once regarded as a theoretical possibility, now appears to be a confirmed reality. The United Kingdom is a case in point. Neil Ferguson, the director of Imperial College London's MRC Center for Global Infectious Disease Analysis, noted that waning vaccine immunity has contributed to the UK's recent spike in cases and calls for a new national lockdown. The UK is the closest analog to America. Like the UK, America has little room for error, and this brings me to our second point. Our second argument is that the path to effective international response to COVID runs through the United States, not around it. The US is sadly the world's global leader in COVID cases. With approximately 46 million cases and 740,000 deaths, America has more than 10 million more reported cases and more than 300,000 more COVID deaths than the next closest nation. Put simply, there is just no hope of addressing global COVID spread without getting the virus under control in the US. The only globally responsible way to curb COVID is to get the spread in the United States under control. Providing booster doses and attempting to support global vaccination campaigns are not mutually exclusive goals. Rather, they are mutually complementary. The goal of the booster strategy is not just to protect the United States citizens, it is to responsibly and contribute to the global fight against the pandemic. US leadership requires proven, demonstrated success, and the only path to a successful US vaccination campaign includes booster doses. The discussion of US global vaccination campaign brings me to my third and final point. Our third and final argument is that global US vaccination campaigns, while imperfect, is far from being globally irresponsible. According to the Kaiser Family Foundation, the United States has pledged over 1.1 billion doses and has shipped over 160 million doses to at least 93 different countries. Of those, over 77 million were delivered to lower middle income countries. According to Reuters, the US has also recently facilitated the delivery of 110 million doses of the Moderna vaccine with the African Union by agreeing to rearrange purchasing agreements. Natalie Quillinan, the White House's deputy coordinator for COVID-19 response, noted that the strategy fulfills the request that the AU has been making on wealthy nations and represent an important area of coordination and cooperation. The Biden administration, like every nation except New Zealand, Thailand, and Vietnam, has had challenges in managing COVID-19. Like every nation, the US is attempting to build the plane while flying it. There are certainly elements of US strategy which could be improved, but the US pledge of 1.1 billion doses, the delivery of 160 million doses, and the recent deal to facilitate the delivery of additional 110 million doses to the AU all demonstrate that the US is not shrinking its responsibility to the globe. Thank you all so much again for joining us, and we are now open to questions from our friends from Team Rwanda.
Thank you. Now we can have the cross-ex again for 2 minutes.
Thank you so much, first speaker from the opposition side. I just had like one question for you, especially when it comes to you talking about the UK's winter surge. You give the UK as a country, you don't want to step in the footsteps of the UK. You want to have another lockdown. But do you think the conditions in the United States and the conditions in the UK are different, given that the UK lifted COVID restrictions and the US has not? And yet you still see the reason why they might have an upcoming winter surge is because of the lifting of the COVID restrictions more than it is about lack of boosters, which is what this debate is about.
That's a very good question. And I would say that the reason that the UK is having a large surge now is because of the lack of boosters. So evidence has recently shown that as about 6 months after the second dose, people's immunity to COVID-19 begins to wane. The UK's recent second surge is coinciding with a time in which people's immunity that they got from the second dose of the vaccine begins to wear off. We would argue that it's not necessarily the lack of restrictions that they have posited that is causing their second surge, but rather the lack of booster vaccinations is the driving cause of that.
Well, my other question, the second question I would add, is maybe that even though the US may have pledged 1.1 billion, don't you think that number would be higher if they instead if they instead reallocated the resources that they're putting into booster shots more, and then they reallocate those resources into actually getting people to get the first 2 doses rather than investing a lot of money in a booster, and then that extra money that they'll have left to be put into more donations and more exportations of like different things.
Thank you, Anok. Now we can have the second speaker from the affirmative side.
Thank you everyone for being here. It's late at night here in Rwanda, and I hear the people from Iowa also having classes after this. It's great to see y'all. I will start over by going over some refutation, and I'll also then rebuild my own case. So I will start off by talking about what the opponents talked about, the inevitable winter surge. I come from Africa. We don't have winter, but according to research, a team of research at Princeton found that although climate is likely to have some effect on the rates of COVID-19, it's far less significant a factor than the control measures in the months leading up to winter, given the number of people who are still susceptible to the virus and how the measures will be implemented. That plays a bigger role in, if the US is most likely to have a COVID surge in the winter or not. So I don't think the high COVID cases, especially in the UK, that you talk about have a lot to do with the not having vaccines, but I think has more to do with the reluctant measures taken by the United Kingdom citizens. So the Britain, remember, as I said, lifted most COVID-19 restrictions due to the high progress received from the first 2 doses. But unfortunately, cases seem to be increasing. And as health experts are telling the British government to impose these social restrictions, such as wearing masks in crowded places, as cases, are increasing and hospitals are filling in again. These reluctant measures are increasing the spread of the virus, not the absence of booster shots, because more than 6.7% million of these booster doses have been sent to the United Kingdom and administered. That makes us question if even boosters are really effective, as our opponents are saying. That leads me to the second point. As you said, the US is the number one global leader in COVID cases. I cannot deny that. It's all over the news. But also it's among the most popular tourist destinations, with over 80 million international visitors each year, including students, investors, and tourists, among others. According to the Vanderbilt Medical School study, vaccination reduces the overall attack rate, to 1.6 from 7.1. We can all agree vaccines are very useful, especially if you're in this time of the pandemic. In the United States only, as I said, it's from 1.6 to 7.1% reduction in the spread of the virus. These results indicate that vaccination has a substantial impact on reducing case transmission and adverse, clinical outcomes. However, with the uptake of less than 40% in the population, vaccination is unlikely to completely eliminate the need for some pharmaceutical intervention. How are these diplomats, investors, and students supposed to travel to the US without vaccines? And isn't the best way to contain the virus through making sure that these foreigners are vaccinated and pose less harm to the United citizens who we are trying to protect here? We're saying that through increasing vaccination coverage and conforming to the World Health Organization strategy of vaccinating at least 20% of the entire population before you can move on to build other strategies to deal with the virus. People who are not vaccinated are also protected indirectly because there is less virus going around. So I would say let us agree to increase herd immunity, and that leads me to the last point. We are calling out the Biden administration COVID vaccines distribution strategy, for being irresponsible, because it has a responsibility to fulfill to the world. Yet it is abandoning that responsibility by creating more solutions that profit its citizens. A concern previously, raised by the World Health Organization. The concern was that these countries that were rooting for vaccine nationalism would at one point put the citizens' rights and its responsibility. It would forget its responsibilities as a country and not help other countries. So it would make vaccines concentrated in one area more than other areas, which is what we're experiencing today. The more the virus infects, the more it's also most likely to create further mutations, which will occur and are inevitable. Therefore, if we want to deal with this vaccine, it's best if we all first conform to the herd immunity. Thank you.
Thank you so much, Assunta. We're gonna have the prospects now.
Awesome. So I guess my first question is about the UK. You made the argument that UK cases have a lot more to do with their lockdown measures, their lack of lockdown measures taken in comparison to the United States. I guess a couple questions to be like, one, how is that different from the measure? Why has that happened in the UK but not in the United States in terms of the difference in the lockdown? And two, what would be better then for the United States and the UK to do to be able to prevent more COVID surge?
Thank you. Great question. So I talked about how the UK's cases are increasing because of reluctant COVID restrictions, and I feel like how is it different? How it's different from the United States is that the United States, in most places at least, they are still uplifting COVID-19 restrictions, and they're still advising their citizens that even with the vaccine, there is a possibility that you can still get the coronavirus. Whereas in the UK, people were reluctant because they knew that they thought that a vaccine would be somehow a cure to prevent them, that would make them not be able to get the virus. So what the US can do differently is first make sure that countries, especially countries, international students are coming, investors are coming from all over the world, make sure that like at least 20 or 40% of other countries are vaccinated first before you can move on to a booster, which you have not yet convinced me is a very effective strategy for going about this pandemic. Thank you.
Okay, hi. Thank you so much to everyone for joining us today and to our friends from Rwanda on giving excellent speeches. I will begin by extending the points made by Elizabeth in the first negative speech, and then continue to answer the arguments made by the affirmative. Our first point is that the United States is facing an upcoming winter surge. This is strong data to support this prediction, as COVID rates are steadily climbing through the country due to the change of seasons and waning vaccine immunity. Much like the UK, the United States is seeing a surge in breakthrough cases among vaccinated, suggesting that the vaccine effectiveness begins to decline after 6 months. Our opponents say that like climate change and winter has nothing to do with the vaccine effectiveness. Our argument is that after 6 months, the vaccine begins to wane, whereas it is not working as effectively as it was working earlier in the months, which is why we need the booster. The booster makes the vaccine stronger within the immune system. That makes it so that it's harder to spread the vaccine, and it's also harder to get COVID. That is why we think that the winter surge is coming, not because of the dropping temperatures, but rather the drop in effectiveness of the COVID vaccine. They also say that social restrictions are enough. Unfortunately, we do not think social restrictions are enough because people need to work. Essential workers exist, right? So people have to go to their jobs, have to go to school, and we think that we should keep these people safe, even in addition to social restrictions. The second argument is that stopping the spread of COVID in the United States is both urgent and complementary with the goal of curbing global COVID spread. The US remains a central hub of global movement and travel, and out of control COVID surge in the United States makes global efforts to contain the virus impossible. While we do agree that it is very important for the US to both support the global efforts, we do not believe that those require an either or choice, but rather an and both choice, right? Our opponents answer this by saying that America is popular for tourists, and we must keep those tourists safe by vaccinating them before they come. we do agree that America is a very popular tourist spot, which is precisely why we need these boosters. It would be very unfortunate to have many people come and take up residence and then get COVID because of our own negligence. Therefore, we have to give boosters to the people who are here in order to curb the spread. Also, it's not an either or choice, as I've said, which means that we can do both, right? We can give the money and the resources necessary to vaccinate people in other parts of the world, while also giving boosters to the population in America as to make sure that the people who come here for tourism stay safe and protected. Our final point is the United States has taken drastic actions to increase its support of global vaccines. The Biden administration has pledged to provide 1.1 billion vaccines, half of the COVAX goal and more than any other nation. And it is doing so in a targeted way to provide support to lower and middle income economies. They answer this by saying that we are being irresponsible and we are proliferating vaccine nationalism. This is simply not true. What I've just said is that we've pledged $1.1 billion, which is more than any other countries. And I would also like to point out that in the first affirmative speech, the affirmative team talked about the lack of resources to distribute the vaccines in the first place. I would say that it is not simply the choice of Americans to not give these resources, but rather we must also work on the distribution of those resources so that when people get COVID, they can have it distributed. Now, the America is not placing profit in front of COVID and the safety of other people. Rather, we are saying that the safety of the Americans is important with the safety of the rest of the world. Being one of the world's largest economy with the most number of COVID vaccines, we have to understand that the goal runs through America and not around it. We must incorporate America and not just discard it altogether. Thank you. And that is my time, and that is all I have to say. Thank you so much. I am now open for cross-ex.
Well, I first wanted to ask you, do you think a booster is more important than the first 2 doses?
I do not. I don't think the booster is more important. I think that these are both important, and I think that America has the money and the resources to prioritize and care for both.
Well, then, if there's a growing anti-vax movement, then don't you think your strength and your effort and your time and resources should be put into encouraging U.S. citizens to take the first 2 doses rather than supporting the booster?
You're absolutely right. There is a growing anti-vax movement, but I would like to point out 2 things. One is that the large populations of people who are not vaccinated are children, right? People under 12 years old who cannot get the vaccine anyway. And 2 is that the American government is working diligently to make sure that a bunch of people who are anti-vax get vaccinated. For example, Biden has made it like a requirement to work for the government. You must have your first 2 doses and stuff.
Okay, well, on your first, okay, you first ask your question.
I wanted to ask about vaccine nationalism, whereby countries sign to pharmaceutical companies so that they can decide to start production of vaccines. And when you're doing that, you are deciding to do it's a collective decision. So why is it that no one consulted other countries before they decided to start producing booster doses, even before other countries could get their first vaccine?
That is a wonderful question, and the reason being is that America has the resources to do these booster shots, and because the population of America needs these booster shots, we have to do these 2 actions at the same time, right? America has a lot of balls in the air, and this is how this is what we think is the best way of helping everybody.
Thank you so much, Subi. So now we're gonna have the audience. If anybody has a question or anything they wanna add on, they could do it in 10 minutes, and then we continue with the rebuttals. Thank you. No questions, guys? No, nothing.
They must be so excited to hear these rebuttals.
I have one,
Oh.
if that would
Oh,
be
okay,
okay.
sure.
I think Assumpta had a good argument to make, and I'm still waiting to hear kind of a better response from Subi than what I heard in the last speech, right? So would you give you a little bit of time, Subi, to continue to kind of rebut that question, because I think it goes to kind of the crux of responsibility, if that makes sense.
I do agree, Paul Bellis. I think they asked very good questions, and I was trying my best. It's as good as I can do. I will work on it for the next rebuttals. I promise I will come back with a good answer.
Yeah, there seems to be a lot of waste when it comes to COVID shots here in the United States. They've been able to identify, and not just waste, but just kind of unilateral decisions of production and distribution, right? Without any kind of consultation or recognition of the sovereignty or needs, right, of other nations. And that seems to me to be kind of a question of leadership versus America first, right? Are we part of the global community? Or are we, just going to make ad hoc decisions that are going to impact others in the collective without a consideration? And I think that is a good question, right, for this debate when it comes to, responsibility. Do we have an obligation, right, to lead the rest of the world? Or do we have an obligation to care for the peoples of other nations? Right? Or is that something that they have contractually agreed to with their own governments and not necessarily ours? And so, that's always a value, right, debate that I think this really kind of is a premise of. Makes for a good discussion. That's all. Thanks.
Thank you so much, Paul. Anybody else? Okay, then if I think there's nobody else, we can continue with the rebuttals. Affirmative side.
Okay, well, thank you. Firstly, I'd like to start my rebuttal by first clarifying something. The second negative speaker was talking about, when I talked about the wastage of doses, I wanted to clarify that the 10 million doses that are being wasted are wasted after distribution. These are doses that have already been taken around the United States. These are doses that have already been put in different medical centers and different, basically different, vaccination sites. And then they're just left there because people do not want to take the vaccine and people don't show up. And then these 10 million doses obviously can be kept over a long period of time and they're wasted. So I just wanted to clarify that small thing before I continue. And the negative team has talked a lot about how like the US contributes a lot of money and a lot of different things. But the debate is about how still prioritizing a third booster is irresponsible. The debate itself reads, the resolution talks about how the Biden administration's COVID-19 strategy itself is irresponsible. So the debate is not about how much it contributes and how many doses and how much money, but it's really about how throughout all this, the US is continuing to prioritize the production of booster shots and the production of and putting a lot of money and time into these booster shots rather than actually helping the world, as I've given different things such as how 6% of the African continent has been vaccinated. So that's just wanted to clarify that thing. And then the second speaker also talked about how has also shown how I wanted to also talk about how even though the booster shot is there, the question is it really necessary, right? I've shown and I've talked about how there are different people in the world different people in the US who are not even taking into consideration taking the first 2 doses, and now you're bringing up the to talk about a booster shot. And I wanted to even talk about how there's an article that talks about how more US citizens are showing up to get a booster shot rather than those that are going up for the first shot. So if this continues, then people are gonna get people are gonna get the booster shot, and then all those anti-vaxxers and all those people that are not even urged to get the two doses, the first two doses in the first place, are not gonna be all these doses are gonna be wasted, while there are all these low income and poor countries that all need these doses that the US is not donating. And I also wanted to ask, how will people get the booster if they don't even have the first two doses? And as I mentioned before, how 98% of 100,000 patients in the US who are on their hospital bed refuse to take the vaccine. It is given to them, they're given the option, but then they choose not to take it. So this is such an alarming number. It really puts the question in your mind, how can the US continue to provide booster shots while this much of its population is not even willing to take the first two doses? And and I think the negative also misunderstood a part of our debate, of our arguments. I think they thought we were talking about how the booster shots are wasted, but actually we meant how the first two doses are wasted, not the booster shots, because those that go for the booster shots already have the first two doses, so the booster shots are not really wasted. But the fact that all these two doses are wasted, while there are countries around the world where people have never even seen a vaccine, people have never even gotten the first dose and anything like that. And the waste isn't about the supply chain, but rather it's about the anti-vax movement. The second speaker tried to talk a lot about how the waste has to do with the supply chain, but no, it doesn't. The vaccines are wasted because people are not showing up. People are not going for the vaccine. Yeah. So thank you, and I want to urge the audience and the jury to understand that the debate today again is talking about how the Biden administration's COVID-19 strategy is very responsible. Thank you.
Thank you, Enoch. Now we can have the negative side.
Thank you. I will argue that the only responsible action that the United States can take is to give boosters to its population. Unfortunately, the COVID-19 vaccine loses its effectiveness after 6 months. And unfortunately, the United States leads the world in global COVID cases. This is something that everyone in this debate can agree on. But unfortunately, this can become even worse due to the fact that the current population of the United States is already vaccinated, needs to maintain their immunity and get boosters. Otherwise, we'll eventually regress back to where we were before the vaccine. Thus, the only responsible global action the United States can take is to give boosters to this population. We need to be able to have success beginning at home. America has lots of tourists to come to and from, lots of international travel, and a large portion of the world's population. The only way in which we could be able to curb global COVID cases is by ensuring that we can maintain the progress that we've achieved within the United States with current vaccination progress. The negative, we are arguing that we still have a lot of work to do, but we don't want to necessarily lose the progress. The affirmative brings up a very good point when they bring up the vaccine wastage in the United States. And we agree. It is very unfortunate that there are vaccine doses being wasted. However, that is not a reason as to why we should no longer give booster doses towards people in the United States. We should not lose all the progress that we've made. We should not allow for people who are immunocompromised, those who potentially have comorbidity issues, those who are elderly. They should not have to risk COVID because they're losing their immunity due to the fact that they lose immunity from the vaccine after 6 months, due to the fact that they were not able to get a booster. We should ensure that those who are in the United States are still going to be able to protect themselves by receiving the booster vaccine. This is the best way to ensure that the United States meets its global responsibilities by ensuring that we don't have even further COVID spread in the United States. Second of all, though, is that we are still maintaining our global responsibility. We agree that the United States is not perfect right now. However, The United States has taken lots of actions towards helping curb COVID-19 globally. The United States has already pledged 1.1 billion total COVID-19 vaccination donations. We've shipped 160 million doses, and we've made recent agreements with the African Union to bring even more vaccine doses towards them. We are not necessarily only focusing on the United States. Rather, the Biden administration is taking steps to make sure that we are maintaining the progress that we've been able to make within this country, and also being able to work internationally to facilitate more doses of the Moderna vaccine, which was given recently to the African Union. The argument they make about whether boosters are really necessary or not it is just shown that they absolutely are necessary. It is unfortunate that there's large portions of the world population who are not vaccinated. However, first off, just losing all the progress we've had towards the currently vaccinated population is not going to fix that. If we stop focusing on the United States, all that means is everyone who's already gotten their second dose is essentially just going to regress back to where we were. Whenever they make arguments about how people come to the United States so they should be able to have protections equally apply towards them as well. Since it is fully possible that since tourists come to and from the United States, and there's lots of international travel, we should ensure protection for everyone who's in the United States, and we should protect travelers additionally. And with that, I urge you to propose by the administration.
Thank you so much. So now we can have the affirmative summary.
Thank you all. I would like to start off by talking about what the opposition side talked about, the booster shots. We are making it look like booster shots are whole different vaccines. It's a whole different brand that's coming up. Yet booster shots are like a third dose given after 6 months. We agree on that, right? So if there are like millions of doses in stock which are being wasted, right? Why are we debating how the United States is how are we debating as if doses are in scarcity, yet they're not in scarcity really. They're being wasted daily because these people don't want to take the vaccines. I'm not even sure the United States has enough equipment to keep these wasted vaccines. So instead of like sending them to Africa, as my opponent said over and over again, we can literally here in Africa have a football field, get a tent, cover it up, and still administer those vaccines. We don't need hospitals in place to have those vaccines there. Really, we just need places whereby we just need the vaccines here in Africa. It's not a problem of hey, there is the bad distribution channels in Africa. No, the distribution channel is not a problem. The distribution channels are from the Pfizer and Moderna and all these places which are delaying the vaccine transportation to Africa. We are okay. We can find football fields. We can find gardens where we can administer all the vaccines to our citizens. That's not really a problem. Also, I would also like to go back to the point where I talked about collective decisions. If the United States pledged to have responsibility of producing enough vaccines for the world, no one should come and convince us that they're having second thoughts about that. The fact that they pledged to make decisions, they were like, okay, we're in positions, we have the resources, we have the materials, we can make these booster shots. If they feel like they cannot be able to do that anymore, they should give that responsibility over to some country which is capable of doing that. And they should not come here and tell us that they're not able to do that all over a sudden because they're having problems with COVID increases, which I do not think they do have anything to do with the boosters. As Subi talked about, there's large anti-vax movements, and as she talked about, the government is doing something about it. But we as global citizens should not be made to suffer for the decisions made by Americans who are not educated. No offense, but not educated, lack information, and who are also willing to risk their careers. Mind you, there are people who are NBA stars who are risking their entire careers just so that they don't take the vaccine. People on their deathbeds not willing to take the vaccines. Here in Africa, we're crying. We are lacking vaccines. Countries like Uganda, Mauritania, and other countries we are giving you from low-income places do not have even the first dose. You don't imagine, no first dose. And you expect us to have, I mean, we will sympathize with your high cases, but I think it has more to do with your administration more than it has to do with the decision you made to the world to distribute the COVID-19 vaccine. Also, no one is asking you to sacrifice your citizens because the vaccines are there, as you said. We're not saying stop distributing them to United States citizens. No, we're not saying that because the vaccines are there. They are present. What you just need is to motivate your citizens to go get them and educate them that the vaccine is a really important thing, that some of us are struggling here and we don't have any. Thank you so much.
Thank you so much, Asu. We can have.
That was such an amazing speech. I feel bad having to go up after that. Let's go. Again, I'm going to emphasize the fact that America can do both, right? America can care for its citizens, which as a government, it has a responsibility to its citizens. And America can use its vast array of resources and money to help the people who don't have access to those resources, right? I.e., we've given the examples of $1.1 billion in what do they call in investments and like giving away money. We've also given the examples of $160 million of vaccines of Moderna being shipped out and given to other nations. So it is not good for if America were to shirk its responsibilities to its own citizens, it would have a detrimental effect to every other country, right? Because you've already said that America has a large tourist economy where people visit and people go. We have to make sure that the people who visit here are safe by giving the people here boosters and making sure that their bodies do not give the people who visit COVID. We also have to make sure that the people who visit other countries are also safe by giving them COVID vaccines and making sure that they are safe during their travels. I am now going to answer a couple of your arguments. The first argument is about wastage, right? There's a big argument of anti-vaxxers are wasting these vaccines. As I've said before, a lot of the people who are not vaccinated are children, people who cannot get this vaccine even if they wanted to because their immune systems cannot handle COVID, right? Second, United States has a vaccine mandate where people who work for the government cannot work for it if they do not have a vaccine. This is one way that the United States is caring for its citizens while also caring for other people, right? Second is that like they don't, you made an argument that you can use football fields and that you don't need the infrastructure in order to distribute. I agree. I do think that African people, being one myself, go Buganda, are very ingenious and can do things by themselves, and they don't need these big fancy hospitals. But they do need the money that America has pledged to them in order to keep, like, to make these things happen, in order to have people be vaccinated. We think that America pledging $1.1 billion is more than sufficient and shows a care for other countries. The last argument you made, another argument you made, was collective decision making. One, we think that America has made good decisions and has been a responsible global citizen. And two, we don't think it's possible for America to make collective decisions because that's just not possible. America cannot talk to every single country and every single person in that country. What we can do is be responsible to the citizens in America while attempting to care for the citizens outside of America. You also said that America should give its responsibilities to another countries. This is simply not possible. America has the highest rate of COVID cases, which means we must care for our people because otherwise other people will also get sick. Biggest number and also the biggest population, which again proves that like boosters here not only care for us, but also care for everyone else. You made a good argument about NBS people not getting the vaccine. Again, vaccine mandate means that these people will be forced to take the vaccines. You do not need to have empathy for us. And in fact, you shouldn't, because America is caring for and has a responsibility to its citizens right now, while also making decisions such as donating money, donating time, and donating resources that would be helpful. Therefore, I believe that America is making responsible COVID decisions.
Thank you so much, Subi.
You are welcome.
Now we're gonna have Ryan doing the closing remarks.
I just want to say thank you so much, Adele, for doing a fantastic job of moderating the debate. To all four debaters, you all were fantastic. I think my neck is sore from having nodded so much. And audience, before you all take off and before we say goodbye to our debaters, if you could please just either use the reactions feature or type in the chat just a quick note to say congratulations and thank you to our participants. They put a lot of great work into making this wonderful debate possible, and we really, really appreciate all of their efforts. Thank you all so much. I am going to stop the recording now. I know that it is quite late,